cost of living, housing and homelessness crisis. But in fact, that this government's priority seems to be to protect the forces in our society who are responsible for and benefiting from the cost of living and housing crisis. And I think this is a fairly unique point that people before profit are making, is that the elephant in the room in the cost of living and housing crisis is the extreme profiteering of energy companies, of banks, of vulture funds, of corporate landlords, and of corporations generally. There's much talk about the extraordinary increase in tax revenue and the surpluses. What isn't remarked upon enough is the reason we have significant surpluses is because the profits of corporations in this country have quadrupled over the last 10 years. So while ordinary people are suffering a dire cost of living and housing and homelessness crisis, the profits of corporations have gone through the roof to staggering levels. And we believe that is the thing that needs to be addressed. The government should impose mortgage interest caps to cap mortgage interest rates at levels that are sustainable and affordable for ordinary mortgage holders. They should impose rent controls. If you look at the ESRI report today, they're confirming something we've been saying for years now, is rent pressure zones and controls of rent pressure zones do nothing to address the problem of new housing and apartments that is developed where the landlords and investors and property speculators can set rents at any level they like. And they are setting them at levels that are totally unaffordable. The only way to address that is to actually control rents, to set rents at that levels that are affordable for people on ordinary incomes. And similarly, that we need to impose controls on prices to prevent the profiteering of big supermarket chains, retail chains, again, who are recording absolutely extraordinary profits. So those are the points we'll be making, and we'll be urging the public to exercise pressure on the government by getting out of the streets on the Cost of Living Coalition demonstration on Saturday, October the 7th.
I want to start by supporting the National Women's Council's campaign, Purple for Public, on the question of childcare. This is a huge issue across Irish society, and the cost of childcare for families are continuing to increase and placing a huge burden mainly on women. And we have research that shows that 1 in 3 women are being forced to give up their jobs to stay at home because childcare is so unaffordable, and that rises to a staggering 60% of lone parents. So what they are proposing has been our policy since we came into Dáil, which is that we need to treat early learning and childcare in the same way as we treat primary and secondary education, that it has to be fully publicly funded and run. We would not treat primary schools as a hodgepodge of privately run organisations, and therefore we're proposing in this budget, Budget 2024, that childcare spending is increased by at least 1 billion, which would be twice what's spent on it now. We spend 1% of our GDP on childcare, which is half of what the European average spend. So that would be our contention, that we should start moving now, transition to a fully publicly funded and run model, and start by paying childcare workers at least an extra €2 an hour and increasing the budget substantially this year.
I want to talk about the scandal at Temple Street. I've been asking questions about this in the Dáil since April, and now finally there is some action by the HSE and the government. I think it's important to ask the question, why after an internal review and an external review already took place, why there is now another external review. The way it's presented by Children's Health Ireland is as if this flows naturally from the last internal review and the external review. That is simply not the case. I think it is very self-evident that the reason another external review has been commissioned is because the last internal review and the last external review did not uncover the key issue at the centre of this controversy, which is the use of unlicensed implants, springs bought off the internet, inserted into children with spina bifida. And it is thanks only to a whistleblower speaking out about that, a journalist, Portugal Mescal, and the Ditch online website which published a story about it, that we are now as far as we are. And what this is a story of is a really shameful failure, yet again, by the state of children with spina bifida, over 100 of whom are on the waiting list for operations for over a year, and now families are discovering that operations were not carried out with appropriately licensed implants, and children did not get the care that they deserved. There's a number of important issues here. One is, I welcome the fact that the external review is being broadened to look at issues of governance generally. I think it is essential that the external review includes a spine surgeon. So the doctor who is currently leading up the external review is not a spine surgeon, that's fine, but we need to get a reassurance that there is going to be a spine surgeon involved in the external review who's going to be capable of going through the patient records and identifying were patients treated appropriately. Secondly, it is absolutely essential that the voices of the patients and the families of the patients are at the centre of this review. There's reports of families being effectively excluded from the previous external review. That cannot happen now. From the very, very start, there needs to be meetings with the families and ensure that they are fully brought to speed on everything that has happened. Thirdly, making sure that this is dealing all with the point of view of governance. And just to finish on the point of view of governance, I mean, there is a very serious problem here, and it's a problem for CHI, and it's a problem for the government. And the government is now taking this very seriously. The Taoiseach has been out repeatedly saying, the reviews need to be published. This is an extremely serious matter. But I raised this with the Taoiseach in mid-July. I raised with the Taoiseach the issue of the internal review and the external review, the need for those to be published. I raised with him the very high complication rates, and I raised with him the allegation that unlicensed implants were being used on the floor of the Dáil, in the Dáil record. And his response to me was saying he didn't know about that, fair enough, I would have to go and speak to Stephen Donnelly. But that was mid-July, we're now mid-September. Did he go to speak to Stephen Donnelly? What did Stephen Donnelly say about it? Why has it taken further revelations by the Ditch in order for some action to be taking place? And secondly, there's very serious questions for CHI. I was putting in parliamentary questions trying to establish whether the allegations I had heard about the use of unlicensed implants were accurate or were not accurate. And the answers I got back from CHI told me on 2 occasions that all implants being used were licensed. So on one occasion, in May, I got an answer which said, to the best of our knowledge, it is standard practice that all implants, specifically spinal implants, have been continued to be CE approved and licensed appropriately for this purpose. I got another answer in July which left out the words to the best of our knowledge and said it is standard practice for these to be appropriately licensed. So we have a real problem whereby CHI is getting parliamentary questions through the Minister for Health, just asking point blank, are unlicensed implants being used? And they aren't able to get the information. They go and find out and come back to me and say, no, everything is fine. And on the face of that, I should just have accepted that and accepted, so the whistleblower who is telling me there's unlicensed implants being used must not be telling the truth, because here we have an official answer that says everything is being used appropriately. So there's very serious questions for CHI about how the previous internal review and external review missed this key point, which, as I understand, is there in the patient record files. It's clear that springs are being used and that are not appropriately licensed for these use. And then they even had parliamentary questions asking about it, and still what it took was the publication of an article to move things on and to have an announcement of a new external review.
And the Stockdale Labour have called for Stephen Donnelly to come back to New York. Do you agree?
I think Stephen Donnelly needs to engage with this. I mean, he began to make some statements yesterday, but I think he needs to come before the Dáil as soon as possible to explain how this happened, to explain his knowledge. Like, he presumably was aware that, surgeries were suspended for months and months and months as a result of the internal and external review. He has to have been known about that. Did he know the contents of that? When did he become aware of the issue of unlicensed implants? At the very latest, he should have become aware in July when I raised it with Leo Varadkar, and Leo Varadkar said he talked to Stephen Donnelly. So yes, I think Stephen Donnelly needs to come before the Dáil as soon as possible. If that means he has to come back from America, well then he needs to come back from America to do that.
Thank you.